He's the Shadow Minister of Health, Dr. Rishad Seecheran. Good morning, sir.
Good morning, everyone. Thank you.
Thank you for joining me, sir. Violence as a public health emergency. From the medical perspective, how could we interpret this? Following the COVID-19 pandemic, a public health emergency, the interpretation may be a bit skewed. What are your thoughts on this, and if you can probably bring some level of clarification to those who are viewing?
Well, I did some research on this, and in the UK, what they have done is they have used a public health approach into tackling crime. And what they have done is they have trained police officers to identify those individuals at most risk, and they then are able to shepherd these persons to the relevant social services that they may require. And this is in an attempt to prevent further crimes in the society. So that's one method of using public health interventions to prevent crime. And that's done in the UK. In the United States, they have also adopted a public health intervention in terms of treating persons that have severe drug overdoses, such as cocaine and fentanyl in recent years. So they are now going backwards and tracing back how these overdoses happened and how they could best prevent these from occurring and stop the overload of the hospital system in the United States. So from a public health perspective, they are trying to get to the root causes of crime in certain criminal activities and try to identify the most at-risk persons, the most at-risk activities, and to use preventative measures to stop these activities from occurring in the future.
Since we've adopted such a term, and as you've just explained in the context of the United States and the United Kingdom, is it very much applicable to the current situation that not only Trinidad and Tobago is facing, but the rest of the Caribbean?
It is not really that applicable. In Trinidad and Tobago, we have a unique situation in terms that we have very porous borders, we have very difficult social and economic conditions. There are some interventions that we can make at that level, but many of the interventions that we would need to stop crime or to prevent serious crime in Trinidad and Tobago has to be done from a policy point of view. We have thousands of students that have lost their place in schools after the COVID-19. At least 3,000 students have been displaced. We are seeing now persons as young as 14 years old are committing serious crimes. We now have the increased cost of living, with increased costs of gasoline, the increased cost of food. We have a lot of joblessness. Many persons have lost their jobs. Many employers have lost their businesses. So it's getting more and more difficult to have a very stable standard of living in Trinidad and Tobago. So there are a number of social and economic factors that are unique to Trinidad and Tobago and may not be applicable to a public health intervention.
If we were to speak about it from the aspect of health and how crime is affecting one's health here in Trinidad and Tobago, because we can focus on the Ministry of Health in a moment or two, but the daily stress, the anxiety, and perhaps even the fear associated with this, what does this mean for an individual who is just trying to get through their everyday life with all the struggles that you've already just suggested, be the economic and social factors?
Well, those are the victims. So before we were speaking about the actual criminals and what we can do to prevent crime, and then now we are speaking about those that the criminals may prey upon. And there's anxiety, there's stress disorders, a lot of mental issues that would go into someone that actually experienced crime, perhaps a home invasion, perhaps witnessing a murder. So our population is under a lot of stress. And more has to be done by those in authority to curb serious crime in Trinidad and Tobago. I would like to mention that in the United National Congress and the partnership government during the period 2010 to 2015, Kamala Persad-Bissessar reduced serious crime to the lowest level in 31 years. assaults, robberies, kidnappings, all of these were carried to the lowest levels. So more has to be done by the PNM administration. We again make the call for Fitzgerald Hines to be removed as the Minister of National Security. Not enough is being done to treat youths. The many mentorship programs, many programs to train these young youths in trade skills have been discontinued by the PNM. And we also have to look into the fact of our drug trade. We have very, very porous borders, and we saw that with the influx of Venezuelan migrants during COVID-19, and as well as the economic situation in Venezuela. So we have an influx of drugs. We have an influx of illegal guns into Trinidad and Tobago. It's very easy to get an illegal weapon. So there has to be more done by this present administration to curb serious crime in Trinidad and Tobago. And what we are looking for is action points from the conference that's currently ongoing in the Hyatt. We need to see a plan of action that can stop crime and can bring some level of safety to the citizens of Trinidad and Tobago.
Well, I think we understand that and we recognize that, but from your viewpoint and perhaps from a party viewpoint, is there enough that is being done to help victims? Because with respect to proactive measures and preventative measures, I think most people have criticisms. But in terms of victims and in terms of those who have been affected by crime, are there enough measures, enough programs that are in place to assist those who are and have been affected?
I don't think so. In terms of our mental health capabilities in Trinidad and Tobago, I have really never heard of any victims getting mental health assistance on a consistent and on a long-term basis from the government. We are also at the point now where many of these victims and the families and friends of these victims are feeling so traumatized that they are begging and they are pleading for a gun license, firearm user license. As well, many are now calling for the recall of the death penalty on criminals. So the population on the whole is traumatized. Many persons do not know how to react to what is going on. And we are all prisoners in our own homes. And what we are seeing now is that we are not even safe in our homes.
But do you have any suggestions for solutions in dealing with the situation to assist these victims? A traumatic situation indeed, from even, if you're fortunate enough to not, there have been people who have had burglars in their yard, but luckily were not able to enter the actual home. That in itself is traumatizing, let alone confronting a burglar. How do any solutions, any options, any suggestions as to us resolving this issue going forward?
That's a very difficult one. We basically have to tackle this problem from the criminal point of view. Those victims would have to seek help, psychiatric help, some level of counseling. Many may do so privately, but that's a very good suggestion that maybe at the public health level, we do create some sort of hotline or some sort of psychiatric help for persons that may be victims of crime, serious crime here in Trinidad and Tobago. But it goes back to the point of view whereby we have to get to the source of crime and what is causing crime in Trinidad and Tobago. We need to treat these young individuals in school. We need to get back to mentoring services at school. We need to get back to even psychiatric counseling in certain schools, whereby persons, youths that are acting out, that are at risk, they need mental and psychiatric help at a very young age to help them through whatever issues that they may be facing in their homes. Some of these persons may be in a single parent household. Some of them may even be living with a grandparent, very little parental supervision. They may not have access to adequate funds or school stationery and supplies. Under the partnership government, we try to provide every student with a laptop. And that would have been so beneficial during the pandemic. A lot of students that dropped out of the system was because they had no access to the teacher and to their classrooms. Um, so there's a lot that has to be done. And we need to tackle these problems in a proactive measure and not in a reactive measure.
Would you say that there is a mental health crisis here in Trinidad and Tobago due to the crime situation or caused by the crime situation?
Definitely. We are currently ranked the sixth most violent country in the world. And that's not a ranking that we should be proud of. Our country is under severe stress. Even in our recent carnival celebrations, um, revelers on Arapita Avenue on the weekend before carnival, they witnessed two persons just walk up to another two persons and shoot them in front of everyone. And apparently hundreds of persons witnessed this, including tourists. So during our most happy period, our most festive period, persons had to witness assassination on Arapita Avenue. So we are a very stressed country right now, and there's a level of hopelessness in the administration, in the PNM administration. Citizens can see no relief under Fitzgerald Hines as the Minister of National Security, and there's actually no chance of any recovery economically or in terms of criminal activity under Prime Minister Keith Rowley.
How would you say this affects our public health system here in Trinidad and Tobago? That's the main focus of the discussion this morning. The
Yes.
public health system and how the criminal activity is affecting our health here in Trinidad and Tobago. And people may say, of course it's affecting our health, it's leading to deaths, which I understand. But there is a part of it of which we tend to ignore, which is the trauma associated with this. How would this affect our public health systems and the systems that we actually have in place here in TNT?
I found that quite strange when I attended the opening ceremony of the Crime Symposium when Prime Minister Keith Rowley spoke about the cost of a chest surgery and the cost of a head and neck surgery. And he's making a big deal about the cost the state incurs in having to treat persons that are involved in crimes. But he failed to make the distinction that besides the cost of these surgeries, persons are dying. We had over 600 murders last year, and we are on course of that to beat that this year. So besides the cost of surgical interventions, we have to take into consideration that persons are losing their life. And it has taken too long for this government under Prime Minister Keith Rowley to try to fix this situation. They have been in power for over 8 years. We have seen crime consistently increase, serious crime consistently increase. The standard of living in Trinidad and Tobago is getting lower. It is becoming more and more difficult to provide for your families, and the population is acting out. Prime Minister Keith Rowley, during election of 2020, told PNM supporters to sign their name with a gold pen. And then now, 3 years into the second term, these persons are begging for hampers. Mm-hmm. So, there's a level of hopelessness, there's a level of disappointment, among his supporters and the entire country on a whole. And many persons cannot provide for their families. We have seen the scrap iron industry basically brought to closure, and many of these persons are on the breadline. And many of their workers are on the breadline. And that goes across the board for many industries. During COVID-19, almost all food industries were closed down, and these persons lost their jobs. Many persons lost their businesses, they lost their equipment that they invested in. So there is a lot to be done. It is more than a public health issue. In fact, it is, in our opinion, not even a public health issue. It is a socio-economic issue that has been created by this PNM government under Prime Minister Keith Rowley.
Well, I mean, is it really fair to say there's a level of hopelessness? The 2020 general election stated otherwise. Hopelessness may lie elsewhere. Who knows? The question now what is the expectation to come out from this symposium?
Yeah, so we are waiting to see that. What my leader has said, Kamala Prasad Bisesa, has said is she wants to see an action plan. She would like to see what is the way forward. How does the Prime Minister expect to treat with serious crime here in Trinidad and Tobago? And last night on the Monday Night Forum, she herself had put forward a number of very useful suggestions whereby she would implement legislation specific to home invasions here in Trinidad and Tobago, whereby persons can stand their ground and defend their home and their families and not be persecuted after for doing so. So that's a very important piece of legislation that would allow homeowners to protect their families and would enable them to use more than reasonable force in protecting their homes, their livelihoods, their loved ones, and their furnishings and their equipment and their possessions in their house.
Mm-hmm. Well, Dr. Seecheran, I want to thank you very much for joining me on AM Prime this morning for the perspective of the Shadow Minister of Health. Keep well, sir, all the very best, and we'll see what happens following this CARICOM symposium.
Thank you very much.
Keep well.